Hi, I'm Lisa Rosenthal, Patient Advocate at RMA of Connecticut, and one of my side hobbies is doing research. And we are delighted at RMA of Connecticut to announce that ASRM, the American Society for Reproductive Medicine, accepted one of our abstracts and presented it as a poster at the conference. And the subject is patient satisfaction and feelings of COVID-19 pandemic. So please do stay tuned for a conversation between Spencer Richlin and myself about what the research showed.
Hello, it's Dr. Spencer Richlin. Great to have you with us. I'm one of the physicians at RMA of Connecticut, and I'm really happy to have and be with Lisa Rosenthal,
Patient Advocate at RMA of Connecticut.
How are you, Lisa?
I'm excited to be here.
Because this is kind of a big thing. We have done some really cool original research that was approved and submitted to
an institutional review board.
Yay.
And then to the American Society for Reproductive Medicine.
So ASRM, which is one of our governing bodies, has research come into them every year, and we had a really cool topic that we presented to them. The topic was, get ready for this great name, was patient satisfaction of implemented COVID-19 protocols in a private fertility practice. So COVID was a really big deal this year, obviously.
It's been a big deal for almost two years now. And the truth is that while there were a lot of bodies governing safety and protocol and all of that, what was left out was the patient voice.
Right, so we had so much going on during COVID that we decided to say, well, how did our patients react to it? What was their experience coming through our practice? And what could we learn now and in the future to help them and help other practices?
Right, we wanted to see what did we do well and what could we improve.
It was a project where we asked questions, we went through our data, and there's certain things that came out that are really interesting that we want to know. We want to know for now, the future. We want our practice to know and other people to know.
You know, as a patient advocate, there was a lot of pushback about, again, that the patients didn't have a voice here and that they were basically being told, and in time-sensitive situations, so women who were, you know, who had low AMHs and who didn't have a lot of time, practices were shutting down. How did people feel about coming into a practice, and did they want to continue services? Did they want to wait until COVID was over, more or less?
I think your point's well taken. Our patients really want a family build. They want to do it quickly and right down the road. And with Corona here, some of them were worried that they couldn't do it or they'd be delayed. And that causes stress also.
And the delays were decided by somebody else without, again, asking their feelings or opinions on whether they were willing to take any risks that might have been associated in the beginning, which is again why certain practices were closed, some for extended amounts of time.
Right. We followed the ASRM guidelines, and we were kind of at the end of the day, and Lisa, you can chime in, we were here to take care of our patients in a safe way.
Yes, absolutely.
And that's what we did. We watched everything we did. I'll comment on a couple, you can comment on some. So we obviously did our PPE. We were very careful in distancing and having our office clean and appropriate and sterile. Any comments come to your mind?
Patients felt safe because we did these things.
Right.
Now there were things that we did for safety reasons, like not allowing partners in procedures and at appointments, or closing our waiting rooms. It was gratifying to see that patients understood and appreciated those measures, even if they didn't like them.
They didn't like some of them. And you know what's nice is we're easing some of them now.
Absolutely.
So we're kind of morphing as things get safer. We're opening up some of those issues.
Yeah, well, vaccinations are helping a lot with that.
So when I think about this original research, and the reality is this is a lot of you and your ideas. You did a great job on this research. And we're all happy that we all were involved with you. We had me, we had Anna, we had our whole team. So let's go through some points. And the interesting points when you do research are is what's significant, what really mattered, and I want to throw one at you. So what we found out was that during this complicated time, during Corona, when we were all very stressed and kind of locked up, we found out that talking to our patients and giving them information about appointments and their results, email worked.
We were shocked.
We were shocked.
We were shocked. You know, we tried. We asked you all about Instagram and you know, texting and calling, and the truth was that I think that the emails were the least intrusive thing.
Right. So people like emails. They said it was just significant that emails worked. I would have thought texting would have been great because it's right there. But so now we know that it's such a great, simple way of communicating.
And it's great for us to know, because why waste our time and effort on a method of communication that is not appreciated by our patients. That doesn't make any sense.
Right. The other thing we think about is, how do patients feel coming here? So we were doing our best. We had our different corona policies and procedures to greet our patients with love, respect, and help them get pregnant. But how did they feel when they came in?
Right.
Comment on that, because this is really cool.
Right, because while we were following the CDC and the World Health and Board of Health and Connecticut policies and all of that, the question is, did people feel safe? And the answer is, they really did. And I love hearing that, because infertility is stressful enough, to add then the stress of maybe coming in not feeling safe. But the overwhelming majority of our respondents said that they came in and they looked at what we're doing and they felt, right? They actually felt safe.
So like, if the environment's safe, then you want to come in, and then you're not worrying about that, and then we're getting down to, let's family build.
Exactly.
I know.
They could focus on what
Right.
the actual point of being here
Right.
was.
I'm a little surprised that everyone felt so safe. It's a testament to everybody in our entire space. From people at the front desk making them comfortable, to our medical systems, to getting the rooms ready, to how we were doing things.
Things were changing sometimes every several hours, and things had to be adjusted. But the pivoting that our practice did was very impressive. Yeah.
Because we had a COVID task force. So every time something would happen, information from the American College, ASRM, we would move our practice where it had to be safe, and have our patients ready to continue family building. It was a busy time, but it was really worth it. Our patients were really happy.
Yes.
Other interesting thing we learned was, we need to get back to you. So we need to respond as a practice, from your nurse, your navigator, all of us. The faster we get back to you, the better. Because then you know your plan of action, you feel like we're with you, we're kind of bonded to you. And your research said that the vast majority of time, and I'm shocked, we got back to people in less than 3 days during this wild pandemic time. That's a testament to everyone here.
It really is.
And that number,
really is.
the 3 days or less was really significant.
That would be significant in normal situations, right? One of the leading forces and sort of things that we were told as team members at RMA of Connecticut is, please don't blame everything on COVID.
Right.
So we had people working from home. We had people working from home who maybe had a sick family member, or had their own small children at home, or had all sorts of things. And the truth is that we got back to people within 3 days, and often in less time than that. That's
so no excuses.
No excuses, exactly.
Right. I'm surprised, but like you said, we had all of us, some at home, some here, spread out, but the communication worked, that we were still able to get back and make things happen.
That's why I say team members and not employees, right? Because we have a leadership here that is phenomenal, but all of our team members really do take their responsibility to their patient very seriously, and it absolutely showed. And when we did the research, we didn't know the answers.
No.
We didn't know the answers. We asked the questions, and we asked hard questions.
I think if we were not together and we had 5, 6, 7 days to get back to someone, that causes stress, and they don't need that now. There's enough going on with what happened with the pandemic, and it's still kind of going on now, but they're trying to get pregnant, so we needed to relieve that stress and keep them on their goal.
And setting expectations, right? So a team member, if they say they're going to get back to you tomorrow, they do. If they say they need 2 days to get back to you, then they get back to you. So setting reasonable expectations also helped a lot.
One of the other things we learned from the study was all about our support services. So this was really interesting. I think, and I know, we're unique in that we have so many different options for our patients. I want you and I just to go back and forth and name them first. We have incredible yoga classes, with Lisa, and videos, and that ability to exercise and free up your mind and be relaxed. We have incredible nutritionists who help our patients kind of get tuned up and ready for pregnancy. You take on one or two.
Well, our mental health professionals, Lisa Schumann and Melissa Kelleher, phenomenal. They were so busy.
We have our acupuncturist, beyond
Amy,
incredible.
Yep.
Amy and her team. We have Jamie, our genetic counselor. We do so many events. We have Ladies Night In. We have yoga online.
Yeah, we have.
So we're unique, and we know that not a lot of practices have all these things for our patients to kind of jump into. Now, the data said, with regard to all the things we were offering, because we were still offering things.
Yes.
Did patients really go after them.
No.
They didn't.
No.
So I'm surprised.
Mhm.
But your theory why they didn't get heavily into our different support services and interact with all those cool people is because
So services like couples night in, ladies night in, men's night in, parenting after infertility, pregnancy after infertility, most of them were much smaller than they were in person.
Right.
So they were more accessible, but there was less people involved at participating. And my theory is that we went into basic survival modes. If you all were lucky enough to have your telehealth appointments with your doctors, you got telehealth out, and there wasn't another remote service that you necessarily wanted. So I think there was less interest. I think there was less time. I think there was a lot of fatigue.
and a lot of stuff going on.
And then there was the other part that we found out, which was that they didn't know about it.
The last thing we learned, telehealth, Lisa, telehealth is incredible. And what our data shows is that our patients loved doing telehealth consults with our docs. They felt the docs were engaged. They had good energy during them. They were very focused. And I think those telehealth visits went incredible. Patients could be at home. You guys could have been one in the car, one at home, or wherever you were, we could talk. And we could still be connected. We're still telehealthing now.
This is the one number that I'll throw out at you. Upwards of 95% of the respondents either agreed or strongly agreed that their doctor was present and focused. That's an amazing thing to be able to say in this situation, and truthfully right. So bad weather, long drives, those
You don't have to drive, you
things
didn't
were
have to
wiped
park.
out. Yeah.
You could be at your own places. And the other thing is, during the pandemic, sometimes people were working from home. They wanted to go under the wire and have no one really know what they're doing, have a little privacy. You don't have to answer to a coworker, where are you going? I can just do a quick telehealth visit, which we're still doing now. I think that telehealth is really cool.
I think telehealth we
It's
should.
here.
The pandemic was nothing that anybody would have ever chosen, but learning certain things from it and going forward and using those things to our advantage makes sense. The truth is that the telehealth conferences serve a really good purpose. I personally didn't meet a doctor for a year and a half, but I felt like I knew her. And when I went in to see her for the first time after a year and a half, we had an established relationship.
Lisa, you love it. I did a telehealth today with someone here and someone else in a different country. Before all this, the technology never bridged that.
Yeah.
This was a great project that you kind of thought about and brought forward. Are you excited about having a poster at ASRM?
I'm excited that we were able to do this. ASRM gets thousands of submissions and they only accept several hundred.
A fraction
of them.
Yeah.
And so to have, again, to acknowledge the patient voice in this, right? And not just the doctors, not just the organizations, not just the associations, but the patient. How do you feel? Do you want to come in? How did we do about, and so there's a wealth of information in this survey, and it was nice to have it acknowledged first by you, by taking this on, so thank you.
It's a great project. We've learned so much. We also want to do shout out to Anna, who's been working with us on this project,
Fontaine.
and Alex Fontaine. They're invaluable. So team. So really proud to be a part of this project. Remember, all of you guys, we have great stuff about everything reproduction on our website at rmact.com. And Lisa, I'll throw it over to you for the last word.
Yeah, I just want to say that, we are here to hear your voice. Whether you are a patient at RMA of Connecticut, or you are not a patient at all, or you are a patient somewhere else, we're here, and I'm here to listen to you, because I think that in this experience, the patients need to be heard.
Okay, thank you very much.